for posterity, a second reading of the budget with a lot of budget reading amendments ahead and a long day. So I'm already preparing in my head. Back to House Bill 44, Parental Rights and Minor Child's Health Care. Welcome back, Ms. Bush. Any introductory comments over the weekend?
Thank you, Mr. Chairman. Again, Sheila Bush with the State Medical Society. I don't have a ton of introductory remarks other than kind of, underscoring what we talked about last week. I did feel like I was asked a couple of questions that I maybe wasn't prepared enough to give appropriate responses to. I'm not a physician. As I like to tell you guys pretty frequently, I have a degree in piano performance. And so when I get out over my skis, I call for help. And so this morning I have Dr. Andy Rose. He's a practicing pediatrician here in Cheyenne and can answer some of those more in-depth questions that were asked.
Welcome back, Dr. Rose. You were with us last year in 2023 on some bills as well. I'm sure you've read over this. Any comments you have to offer before we ask some questions?
Sure, thank you, Chairman. So I'm Andy Rose. I'm a pediatrician practicing at the Cheyenne Children's Clinic. And after reviewing the video from the meeting last week, I just wanted to try to clarify a couple of things if it's possible, and then I'll certainly be open for questions. I don't believe that the intent, just right off the bat, I guess, hitting home, the intent of one of the bill changes to remove and I guess improve parent rights. I want to just say that in terms of minors and their medical records, I don't see this bill doing that, only because parents have access to medical records through a number of different ways. And if possibly, it sounds like maybe the hang up was with a online portal system. This law really doesn't deal with that in terms of access to records. So, but what it does do is it does limit access to care, which is what Sheila brought up last week, and especially in ways that seem to me to be not effective. Primarily, we can talk about the section that discusses tobacco cessation, and minors who are using tobacco typically aren't sharing that with their parents, and to then be able to then make it harder for them to want to talk with me as their pediatrician who could help them, could direct them in the right ways, and then not be able to do that in confidence with them. There's actually really good data that shows kids will be much less likely to look for that care. So it limits access there for children wanting to get help. And then the other section, I think in emergency situations, there are just a lot of things that, and a lot of moving parts that, again, I would be open for questions, but if for instance, I think one thing that came up, right, was an example of a time when emergency care would be needed for minors when parents couldn't give consent. And, unfortunately, I think you guys actually did come up with a few good examples. The Ebola type of, unfortunately, Ebola, Marburg virus, and many others have been sort of cited as possibilities for bioterrorism. And unfortunately, in our world today, I don't think, especially after the COVID pandemic, that is so far-fetched of an idea that could possibly happen. And one of the only ways proven in pandemic and epidemic responses and bioterrorism response sort of planning is to rapidly vaccinate all exposed people. There's basically instances where doing a rapid containment of one of those vaccine preventable diseases could really stop that outbreak from starting at its source. And so to limit that and to have it so that just we here in Wyoming couldn't be able to use that option seems a little unreasonable, especially with how close we are to a military base. So, but I'll be open for questions.
Okay. Cool question to Dr. Rose. Representative Ward.
Thank you, Mr. Chairman. Dr. Rose, I was told by other medical professionals, particularly in Casper, that this was one of the reasons that parents could not access their 12-year-olds' online medical health records. So what you're saying about it not having to do with access to medical records is something different than was told to me by some other medical professionals. I'm wondering if you can expand on that.
Sure, Dr. Rose, if you know.
Well, yeah, Chairman and Representative, the instance they were discussing, I don't know details of, but the law as it states does not limit that parent access for all other things except for if that child was using tobacco and they were in that visit with that as a sort of one of the diagnoses, then yes, that parent would be limited and not be able to see that note. But I don't, and that, there are a few other cases. So I don't know this, again, I don't know this instance, but could this person have had, could there be either physical abuse, sexual abuse? There's a lot of other reasons why possibly a parent is unable to see a child's chart, and it's usually for safety of that child. And in this case, it's so that child, that adolescent can get care that's appropriate for them and to do it in a way that they will be, again, more likely to actually seek it out and not fear that retribution, I think is the word, a retribution from their parents.
Follow-up, Representative Ward.
Yes, do you recommend COVID shots for children?
Dr. Rose?
Yes, I do. They've been proven to be very effective and safe. So, we in our practice offer them. It's not something that is ever forced upon anybody, but we know it is a part of, again, pandemic response that has shown to be effective.
Representative Ward, third time.
Thank you, Mr. Chairman. Dr. Rose, you are aware of the correlation of myocarditis with those shots, right?
Getting a little in the weeds, but Dr. Rose, if you are, let us know.
Chairman, we are aware, and that it has been well documented in terms of, again, safety. And if we need to go into the data, we could do that. There's a lot of misinformation that is out there about, not just COVID, but vaccines in general. And so I just stand by that vaccinations, including COVID vaccination for children, is a safe option, and it happens. And it's what helped stop the pandemic.
Representative Hornock, question?
So in your testimony, you gave some broad examples, emergency situations. Have you personally run into a situation where there has been an emergency that that this would apply to, where you've dealt with this in your practice? Has there been a specific instance that you've had?
Dr. Rose,
Chairman,
broadly.
Yeah, Chairman and Representative, I work in a outpatient practice primarily, and I do cover the hospital sometimes, but no, there has not been an instance where I, not working in an emergency room, have had to, luckily, where I have not been able to get a hold of a family, and I'm assuming you're talking about this section of the bill where getting a hold of a family in an emergency situation, right? Not the nicotine part. So there's not been an instance where I've had to do that. I've definitely had discussions with adolescents about nicotine cessation. That happens a lot. But in terms of emergency situations, I think what we're dealing with is the 9/11 type of response when, heaven forbid, there's a, mass casualty or some other bioterrorism kind of event, and what is needed is similar to what happens with a rabies exposure. Rapid rabies vaccine is given when someone has a exposure to rabies, and if that is delayed, there can be, very bad consequences. There was a death from rabies here in the state of Wyoming just back in 2015. And those are the kind of viruses that we're talking about as very rapidly and, very lethal, but also potentially rapidly spread viruses if they're put into that bioterrorism kind of a pathway, or if, heaven forbid, again, something like that would happen. But no, I do not have any specific examples that I could share in my own practice, no.
Okay, other questions for the Medical Society? Representative Clouston.
Thank you, Mr. Chairman. So, Doctor, thanks for being here. Some great testimony. I appreciated it. The only part of this, I guess, I'm really disagreeing, or I need some more information with you, is if you can just give me some more examples on the smoking cessation. I guess as a parent, if my child is going through some destructive habits, I feel like our most successful outcome would be me working with my child, and I have a right to work with them. And maybe this bill isn't written the way for what I'm looking for, but I just need to know from you that you feel like this smoking cessation program is effective and it's better not having the parents involved.
Dr. Rose.
Chairman and Representative, thank you for that question. I totally agree with you in that most cases, parents would be the way to go. I would love it if that were in a perfect world. Every parent has a great relationship with their child, can speak with their adolescent, have the rapport and the ability to help them make good decisions. But unfortunately, that's just not the world we live in. There are unfortunately cases, like I mentioned, cases where there's abuse going on, there's something else where the children fear that sort of retribution. And I think in a lot of our homes, we would want to have that open kind of conversation, but a lot of homes, that kind of open conversation is not welcome. And if children were to try to go that route, I think, again, it's data has definitely shown adolescents in general, even potentially, in households where there isn't obvious abuse and things like that, but there's just that fear, and adolescents will not undergo treatment or seek out treatment if they fear any kind of, getting in trouble. Most of the time they're doing this without our knowledge, right? And I think they're going to continue doing that. They're more likely to continue and not get help just because they don't want it to come to light.
Representative Penn.
Thank you, Mr. Chairman. Are you obligated to report incidences where you suspect child abuse?
Yeah, Chairman and Representative, yes, we are.
Other questions for the Medical Society? Ms. Bush, one more.
I was just going to offer, in looking at the language, it feels as though, in direct response to Representative Clouston, one fix that you could contemplate that would leave the pandemic response language intact and potentially get to a halfway point or a compromise would be to leave the tobacco cessation language as it is and then add a sentence that clarifies, because there does seem to be some disagreement. Representative Ward was told one thing here in Cheyenne, and what we understand about our system, it's different. And so you could add a clarifying sentence that just says, a parent has the right to see the record. So you could leave that component about not requiring consent in place, which I think addresses, a situation of a youth seeking help. But if a parent really wanted to make sure that we had access to that record, and if any parent could call the hospital or get that record and say, what treatment has my child received, you might have an opportunity for some middle ground there. It's the position of the Medical Society that the bill shouldn't move forward at all. We think that, if there is something that's truly concerning in terms of access to medical records, we could work together and get there a different way that might not roll back some really important public health safety measures and things that live in statute, or inhibit a youth from getting the care that they need. I would offer one other thing in response to Representative Hornock seeking a very specific example here in our state. It's my understanding that in 2002, when the Transportation Committee contemplated overhauling our public health statutes, they looked across the country for best practices. And so they took all of the language from different states and what they thought really was the best. And so what you likely have in front of you comes also from states that have significant and frequent natural disasters that lead to public health emergencies. We're very blessed in this state. We don't have a lot of that. I think our biggest threat is maybe Yellowstone erupting at some point. We don't have hurricanes. We have very few tornadoes. But I think that having that in place and leaving that language intact is a good idea. It has been established as best practice. It's across the country as sort of, the things that you do in a mass casualty or a significant natural disaster. So hurricanes, tornadoes, a volcano, who knows? And so that's why that language is there. I think we can't give you a specific example here with our providers in Wyoming because we just haven't had those events here. We haven't had a Katrina. And so that's why we can't give you a specific example, but why the language is really good language and should remain in place.
Do you know if any state's taken out that language in the last 20 years? I don't know in your research if you've seen any updates. I think everyone did something similar in about 3 years after 9/11 and
Yeah.
anything.
Mr. Chairman, no, I don't know of any states who have removed this language. I do know over the weekend I did some research on the nicotine cessation piece, and our neighbor to the west, Utah, is actually strengthening their language for the nicotine component of this bill. They have language similar to ours in statute, and they're actually adding a lot more language to make it even easier for youth to access nicotine cessation therapies and the like. So in terms of when we do state comparisons, some love to do it, some don't like it as much. But Utah in many ways is similar to us in a lot of their, I guess, political leanings, and they are strengthening their language.
Thank you, Mr. Chairman. This question is for Dr. Rose, and it escaped my mind. I'm sorry, Mr. Chairman, come back to me in a moment.
No problem. I bet they'll be around a bit if we need to call them back up. Anyone else? Seeing none. Thank you much, Ms. Bush and Dr. Rose.
I'm sorry.
Nope. All right, sit on back down.
Thank you, Mr. Chairman. Please forgive me, Dr. Rose. When you do treat minors for tobacco cessation, who pays the bill? Because if it's hidden from the parents, how can they pay the bill?
Dr. Rose.
No, that's a great point. Very good point. So parents will still get a bill, and I think that's potentially where a sticking point comes up. But and it's not that, you want to keep the secret forever, but I think getting that original access and being able to tell an adolescent that I'm going to keep this in confidence. We can talk about this problem. I know you have been vaping, and vape pens are incredibly easy to hide from parents. I'll just tell you right now, that's something that these kids are unfortunately doing at high rates. But you're right, they're going to get a bill. Parents, if parents, they're the ones getting the bill. So eventually that is something that probably comes to light. But as long as we don't access that initial entrance into care, we're able to provide it and hopefully help them on the path towards cessation. Maybe their parents do find out. And what I try to do is I try to have that conversation. Okay, you're getting help now. We're going to bring your parents in and we're going to talk about this together. And we're going to see if we can't come, it's sure a lot easier to have that conversation when I'm in the room potentially and make it so that this is not just about one child hiding something, an adolescent child hiding something from their parent, but we're all working on this together to help this kiddo get over this nicotine addiction.
Thank you, Mr. Chairman. So I was told previously that the parents don't get the bill because HIPAA would prevent that from happening. They're not allowed to know about the fact that their kids are getting this treatment. They wouldn't get a bill.
Dr. Rose, do you have, adolescents come in specifically to talk to you, or is this usually something as part of a routine medical exam, a physical, and then so it might not be documented the same way you just bill it for a physical instead of billing it for prescribing a certain type of gum?
Yeah, Chairman, good point. And thanks for the question, Representative Ward. The ins and outs of the billing, that process of billing would be different in my practice versus, say, my psychiatrist at my clinic who does more, protected mental health and probably a lot more substance use sort of counseling and things like that. So what Chairman Swanitzer said is very true. I will see kiddos for their sport physical or for their wellness visit. And and certainly there's still a bill that goes in for that. But there, honestly, a lot of times if they typically don't come in just for that reason, right? They're going to come in and say they have headaches, they're going to come in and say something else. So it also could be that we, the overall charge is dropped in a different way, and it doesn't necessarily have to be linked to that smoking cessation thing. So you're right. I mean, there are ways that I think can be probably done, but we don't try to necessarily hide it from parents.
Mr. Chairman, I think we're maybe mixing up a couple of different things. Wyoming also has the quit tobacco, or the quit line, and that is free of charge. That's in part, and I think the Department of Health is here and they can clear up all of the wrong things we've probably said, but I think we're talking about different things. And so you may have been told something that was in light of the quit line. And so I know there's data available. I spoke with Representative Trujillo about some of that data and how many kids have accessed that quit line or received counseling, those kinds of things. That's free of charge. So there is no bill to be had. So I think someone needs to come up probably from the Department of Health and clarify that there's different pathways, and healthcare is really complicated. And so, thanks. If I say it enough time, they'll just come sit next to me. So I think that there's the private clinic, there's the Dr. Rose example, the way his clinic works. Then you have the public availability of some of these resources, and that works a little different. And so with that, I'll just give it to Stephanie.